Hi, my name is Frank Feigenbaum. I'm a neurosurgical spine surgeon. I operate in Dallas, Texas, Kansas City, and here in Cyprus. We've set up a world-class institute for the treatment of patients with spinal meningeal cysts of multiple types, and it's called AIMIS, the American Institute of Minimally Invasive Spine Surgery. There are multiple types of meningeal cysts in the spine. The most common types are Tarlov or perineural cysts and meningeal diverticula. The cysts can occur anywhere along the spine, but the most common location is in the lower lumbar or sacral spine, where the cysts end up compressing the nerve roots and causing very painful symptoms.
I came to AIMIS because I was diagnosed with a giant meningeal cyst, which was 8 centimeters by 4 by 2, so a pretty big one, which was in my sacral area.
This problem started 1.5 years ago. It started as an annoying pain on her low back and left leg, but during the passing time, the annoying pain became a dominant pain.
I heard about AIMIS through the internet because I've been suffering with Tarlov Cyst since 2010, and doing a lot of research on the internet, I come across AIMIS.
After I finished training, I found that there was this very large population of patients who were suffering very badly, mainly because there was no established treatment for Tarlov cysts. So I came up with a way to treat them, and it's been very successful. And I have kind of devoted myself to the treatment of patients of Tarlov cysts and other types of meningeal cysts as well.
The medical system in France was only saying to me, well, this is all in your head, or we can't do anything about it, just take antidepressants. I refused all that. I refused all medication, I refused antidepressants, I refused everything. This is not what I wanted to hear, because I knew something was wrong with my body.
I was unable to find help after 5 years of trying in New Zealand and looking at Australia, and discovered on the internet that there was a world-leading doctor available. And I followed that up and worked through social media to discover where he...
My spinal problem started in 2010. At first I had a lump. I felt like a lump on my back, and I left it for about 2 or 3 months. Until then it was getting worse, so I decided to go and see my GP back in the UK, and he told me I pulled a muscle, so he gave me some painkillers and to leave it, that it would go away.
I'm at Amos quite simply because I have struggled for 12 years to find a solution.
The service that we offer here at AIMIS is unlike any other service in the world. We have a fully functional, informed institute available to international patients to come from overseas and have their symptomatic meningeal cysts treated. And also AIMIS offers a wide variety of treatments for all kinds of spinal disease using minimally invasive spinal techniques.
The experience of coming to Cyprus to go through that operation was pretty intense, obviously, because I am quite an anxious person anyway. So the experience was pretty intense, and even arriving at the airport, where a member of AIMIS came to pick up my luggage, came to get me and my wife, brought us back to the hotel before the operation. I mean, everything was very well taken into charge. The hospital itself is extremely modern, extremely clean. I have seen much worse in my life, that's for sure. The premises are great. You are under surveillance 24/24. If you need anything, anyone's there. They do ask you questions all the time, they do treat you in a good way.
Having educated myself on Tarlov Cyst and the treatment of it, I realized that my only option to recover was to be treated by Amos's neurosurgeons.
AIMIS helped us with the travel arrangements, as we've never been to Cyprus before. So they explained to us everything, and one member of the staff, it was really amazing, he's called Arthur, and he helped me. We were WhatsApping, and if I had any questions, he was always answering me and reassuring me and looking after me really well.
As patients find us, they communicate with us and send us their imaging studies, and we respond and get certain information from them that we need, and then one of us calls them and we talk to them and really discuss what their symptoms are, and I can review the imaging studies and discuss with the patient what their imaging studies show and really see if their symptoms match up with what their imaging studies reveal, and if it appears that the problem on the imaging study, in other words, a cyst in the spine, explains their symptoms well, we might offer them surgery. The patients then come, and then we have the opportunity to sit down with them, examine them, talk, and explain the surgery again. And if they decide to proceed, we'd have surgery scheduled for the same trip, and they can have the treatment that they need. Our facility here in Cyprus is outstanding. I've had a great experience here. It's certainly world-class and on par with any hospital in the United States, and I've been thoroughly satisfied with not only the hospital itself, but the staff, and I've been very appreciative of the care they've given my patients. Cyprus is a great location for patients to come and get treatment. It's a very friendly country. The people are very welcoming. It's a very safe place. The temperature and the weather is very moderate and very conducive to recovery for patients and their families when they come. So without reservation, I recommend Cyprus as a location for coming for treatment.